Imagine there's no health insurance. Hi, I'm Scott Ott with Stephen Green and Bill Whittle, and this episode of Right Angle is brought to you by the members at BillWhittle.com. And gentlemen, the governor of the state of Georgia, one young Brian Kemp, actually just signed legislation creating the possibility that patients and their doctors could enter into direct primary care agreements that would essentially bypass most of the world of health insurance and have the patient pay a monthly fee to the doctor who would agree to provide a list of services. And this passed in Georgia, and the effect of it is that doctors are no longer bound by restrictions brought about by insurance companies or by insurance regulators, and so they can charge less for their services, they can hire fewer employees, and the advocates of this concept say that eventually this beneficial arrangement will drive out others, such as Obamacare. Stephen Green, this seems like a fascinating way to approach the problem. The concern that's been raised, though, Steve, is that only the wealthy will have access to health care if we make it so that they enter into these flat fee payment agreements.
Yeah, nothing makes things more expensive than the government trying to make them more affordable. We see this all over the place. One of the reasons college education has become so expensive is government guaranteed student loans. Or now the government runs the whole program, so it's going to get even worse. But the thinking of it was, gosh, college costs some money, and if the government would just step in and insure those loans, why then everybody would have access to the credit they need to buy themselves a college education. And that sounds great in theory, except once the price pressure is removed from the student, then the colleges stop competing on who can provide a quality education at a decent price and who can provide the best amenities. Have you seen dorm rooms at a modern university? When I was at University of Missouri in the late 80s, my dorm room was a lovely selection of linoleum and cinder blocks. Okay?
Absolutely.
Yes. And now you go to these schools, and the dorm rooms, not the wealthy fraternities or sororities, the dorm rooms look like hotels that I can't properly afford to stay in. And this is because the government has made it so affordable to borrow money for your education. And the administrative costs just balloon, because why not have a secondary dean for stuff that nobody cares about when all of this money is coming in? And so you've got so many more administrators than you have professors, and the same thing, of course, has happened in medicine. And in addition to which, you've got the regulatory burden, which is absurd. I had to have an x-ray on my hand last year, and the x-ray was $425 after my insurance had kicked in. And this used to be a simple procedure where you go in and you zap and you're done, and I don't know, it was maybe $50 cash, and now it's $425 after insurance had paid for whatever percentage of it. I don't know. It's madness. It is absolute madness. It does, for primary care, is aspirin and a stethoscope and stitches. Okay, I mean, just boiling it down to the most very basic. Primary care does not come down to much. It should not be that expensive, and yet it is. I think what Georgia is trying here is a brilliant experiment. I think it's going to succeed marvelously, and if I'm wrong, well, I'm wrong, and Georgia was wrong, and it didn't affect the other 49 states of the Union.
Now, Bill, this is a fascinating sort of free market approach to doing something that Republicans have been trying to do for some time now. Republicans politically seem just obsessed with fighting Obamacare, even now that it's been in place for all these years. And yet here is this little state of Georgia saying, we have another idea for how you can arrange this. And by the way, doctors report that they can actually downsize the staffing of their offices because you only need one full-time employee for every 2 doctors if you're doing these direct service agreements, whereas previously you needed to have 7 employees per doctor just to maintain the overhead of all the insurance regulations. But here was the sort of the money quote from this story, and I should give credit to the newamerican.com and for the member at billwhittle.com who suggested this story. Here's the quote I like. A more open healthcare marketplace within a state will help spur de facto nullification of the federal program by providing an affordable alternative. As patients flock to these arrangements and others spurred by ingenuity and market forces, the old system will begin to crumble. Bill, do you think this guy's just drinking the Kool-Aid and is kind of caught up in some fringe activity, or do you think there's real hope for this?
I sincerely mean this. This may be the best news to hit the United States since Donald Trump was elected, because the healthcare issue is an entire microcosm of our entire relationship to the federal government and how badly off the rails it's gone. The reason that if you bill something to your insurance, 1 aspirin tablet is going to cost $20 on the bill. For every little tablet of aspirin they give you, the insurance company charges that out at $20. If you buy 100 of them at Walmart, they're 2 cents. So that's 1,000 times more than what they actually cost. And those prices have to be inflated in order to pay for these standing armies of people who do nothing but make sure that the aspirin's being administered in this particular case. So the 2 things that are really salient here are the economic effects, number 1, which Scott pointed out. To give you a quick idea of this, if I spend $1 on health care, if $1 is taken from me for Obamacare through taxes, it goes to Washington. These numbers are more or less correct. They peel off about 33 cents of the dollar. Then they send it to the insurance companies, and they peel off about another 34 cents of the dollar. And then they pay the doctor who's providing the health care. And the doctor gets 30 cents, 32 cents on the dollar. So why don't I just give the dollar directly to the doctor? And that way he won't have to see 3 times as many patients in order to make the same money he was making before. So it's absolutely brilliant in that regard. But the main thing that needs to be said about this is we do not have health insurance in this company in terms of what insurance really is. If our cars had the same kind of insurance as we do, then we would be able to go down to the car dealership and charge them to change the oil, and there'd be no charge, or to clean the windows, no charge. There's no limit to it. It's not insurance, which means protection against catastrophic loss. So this kind of plan is predicated on something very simple. We're going to pay a doctor directly, which means he gets all of the money, not a third of the money, which means good, fewer lines, more time, better care, great. The doctor then will do everything that is possible to do inside a doctor's office for me. And then instead of me buying this health care, which costs here in California, it's just shocking. It's a couple $1,000s a month for 2 people in California. It's unbelievable. Instead of that, then the person goes and buys stop-loss insurance. It's basically it's an insurance policy against something bad happening to them. So that if it turns out the person gets into the kind of place where insurance is actually necessary, you have a cancer, let's say, or you've been in some terrible physical accident, and you're going to be basically drawing hundreds of thousands of dollars of medical fees, then you use the stop-loss insurance for that. But the beautiful thing about this is, if this kind of thing goes into place, then we won't be talking about hundreds of thousands of dollars of medical fees. We'll be talking about tens of thousands of dollars of medical fees, because this thing is like a tornado that just sucks up all of the inefficiency and bureaucracy, which creates more bureaucracy, which means less money, which means more patients, which means worse care. And I think this is absolutely spectacular news, and they're right. This will put Obamacare out of business, and this is the kind of thing that Republicans should have been promoting from the beginning, not just like, well, we don't like Obamacare, we have a slightly less impressive version of Obamacare. No, the answer to Obamacare is health care on a direct basis with a doctor, the way it used to be, and getting a $20 pill down to 2 cents again, or at least $2.
I took my car to a repair shop, and the mechanic came out and said, well, we've had a look at your car, And we have to do a kind of a test. We're going to actually insert a camera, a tiny little camera, down inside the fuel line and be able to examine the fuel line. Now, there are two ways we can do this test. One is we can use a black and white camera, and the other is we can use a color camera. And the color camera is actually more effective because you can see more things with it. Things show up in color that you might not have noticed if you just saw the monochrome. And I said, well, what do each of them cost? And the mechanic said, I have no idea. No, I'm kidding you. That actually happened in a doctor's office when my wife was having surgery, and they said they wanted to stick a camera down inside her. One was a black and white camera, one was a color camera. The color camera would show more detail because of the color, obviously. And I said, how much do each of those tests cost? And the doctor said, I have no idea. And I had to get on the phone and call the billing office and say, hey, we've got two different procedures here. What are they called again? What's the code number for these procedures? And somebody in the billing office then had to get back to me and say, okay, here's the difference in price between these two. And I don't remember exactly now what it was, but it was a substantial difference in price. To me, that just highlighted the mess of a problem that we're in with healthcare. When I walk into Firestone, for example, which is one of the bigger franchise auto repair zones, you may think that Firestone costs too much, but you know exactly what they cost because there's a menu, and on the menu it's got the prices. When I go to a restaurant, the menu has the prices. But when I go to a doctor's office, not only do I just give them carte blanche to do whatever they want, but even the people who are bringing you the product don't know what the product costs. They can't involve themselves in that because it's too complicated for them. So what kind of business what kind of business do we want our healthcare business to be? One where the care providers are not even aware of the emotional, financial impact on the patients to whom they purport to care about? Or one where you can say to your doctor, look, I'm going to give you, by the way, the cost of according to the Direct Primary Care Coalition, the typical cost of one of these direct primary care agreements is about the average cell phone bill. So let's say we're going to go to the doctor and we say, I'm going to give you $100 a month or $150 a month or whatever it is. And here's what you're going to provide for me. And you have this list of services that they'll provide within that context. At least I know what it costs. And I can feel good about that. And I can go, okay, well, if I need this service, that doctor doesn't provide it. But if I need an aspirin, or if I need some minor surgery or have a mole removed or something like that, that's going to happen right in the office. It will be covered within the $150 a month that I'm already paying. I like that.
Yeah,
there's a lot.
There's something about, what's the phrase, Occam's razor, where there tends to be things that are simple have a distinct edge with me, and I think with most Americans. Could there be problems arising from this? Certainly. Can there be bad actors who enter into fraudulent primary care agreements? Absolutely. But no more so than there would be under any other system. And I say, hurrah for Georgia. Give it a shot. Let it be an example to other states. Let other people try it. And I can't wait to find maybe it's already available in Texas. I wouldn't be surprised. But I can't wait to find out how this works in Georgia. And I think this is the best way for Republicans to defeat socialized medicine systems is by driving it out through market competition. For Bill Whittle and Stephen Green, I'm Scott Ott. Thanks to the members at BillWhittle.com for making Right Angle possible.